Hey, it's Dr. Chris. It is Thursday and we are live with Q&A for a biologic dentist. Um, I'm at the home office because my car is broken. And yeah, it's really cold here in Montana. So I am not able to go to my studio that I usually go to. So let's hope this sounds well. Anyhow, we're going to go through again some of the Q&A, some of the questions you guys have posted on the videos that I have recently uploaded. And if you have questions that you want answered, you can go ahead and put them in the chat, and I will try to get to them periodically. I'll make this a short live because I do have to go and get this car situation resolved, or I can't go to work on Monday. Anyhow, the video I'm going to go through today that has a lot of new comments is root canal versus extraction. What would a dentist choose for themselves? And if you guys don't know my story, I had a root canal done on my upper left molar up here, what's about 20 plus some odd years ago. And that was fine and dandy. But the reality is that, can't see myself. The reality is that after realizing that the coming and going achiness was not normal, and that every time I got a little under the weather, I would feel the achiness of my tooth, my root canal treated tooth. So I decided to do some 3D scans, and initially I sent them to my endodontist friends who confirmed that it was just fine. And it wasn't just fine. And I know this because when I had it removed about a year and a half, almost 2 years ago, a lot of things got better. My back pain went away. My neck pain got 90% better. And so, a lot of things got better. And this is anecdotal, of course. This is for entertainment purposes only. So if you have a question, you can ask me, but I am not your dentist. I'm your second opinion, if that's what you want to look at it like. If you want an opinion by me, you can call my office, Saddle Peak Dental in Montana, Bozeman, Montana. And very often we can accommodate questions. Telemedicine is something that we all do these days. So if you would like me to review x-rays or your 3D scans or have a conversation with you, you can do that by calling the office and booking a time slot. Anyhow, that being said, let's get back to the video. And let's start. I do need these for reading. So yeah, I can see it's frustrating. So there's one person just posted Trent McAvoy 2011. So how come, if this is all known to every dentist, why are they still doing it? I thought cause no harm was the Hippocratic Oath. Guess I was wrong, and a bunch of dollar signs. So yeah, most dentists don't mean wrong. That's my opinion. I feel most dentists generally want to help you. Okay. They have a certain toolbox to work with. They were taught certain procedures for certain things, right? So if you have a dead or dying tooth, often root canal is the logical next step. This is how we are all taught in dental school. What we are not taught is the things that don't align with the philosophies of the dental schools, with the endodontic societies, the dental societies, which are sponsored often by and kind of controlled by Big Pharma. So there we are again. Now, this means that you're not going to get a lot of information, research studies on the focal infection theory. Okay, just like the germ theory, it's a theory that bacteria don't simply stay in the mouth, they travel everywhere. So we kind of have beaten that horse too many times. Okay, there's some videos on it, but the summary is that bacteria do not stay in one spot, especially in your mouth. They travel all over your body, to your heart, to your brain, everywhere. And this has been well documented. The root canal specialists still claim onto the notion that They are special in that root canal bacteria do not go anywhere. They simply stay put. But all the other bacteria in your mouth has been linked to all kinds of things far away from your mouth, your heart, your brain, across the placenta, things like that. So you make up your own mind what you think is truth and what is preservation of capital, income. So, that being said, not every dentist knows this. Yes, they should. And yes, ideally, they would have a discussion with you on the pluses and minuses of root canals, implants, extractions, and so forth. And then you are the boss of your mouth. You get to make the decision that is best for you, right? If you get one sided opinion with no other side opinion, you're not getting an opinion. You're having somebody tell you what to do. That's not how medicine should work. So, the Hippocratic Oath, interesting. Yeah, a lot of people claim that, but do no harm, right? That is the thought of the Hippocratic Oath, and nobody really goes into medicine to do harm. Ignorance is bliss, as I like to say. So they generally don't believe they're doing harm to you. So it's not like you are being singled out, and it's not like they're just trying to do it for money, because all situations in dentistry are expensive. So money will come one way or another. It's more of what they believe based on what they've been taught. So unfortunately, education seems to be the answer. All right, let's go to the next question. All right. This sounds exactly what happened to me. Yes, this happens to a lot of people, unfortunately. So, why is every dentist wants to refuse to remove it? I'm trying to find someone who's ready to remove my tooth. Boo Boo Blue J4N. Quick little thing on that. We just touched on that again. You are the boss. Your dentist can refuse to treat you. That is their prerogative. It is a two-way road. We don't take every patient, and every patient doesn't stay in the practice. They get to stay and they get to leave. We get to work on you if we want to, and we get to work on you if we get to let you go out of the practice if we don't want to work on you. That is how this world works. And that's the way it should work. So if you can find a dentist who follows the philosophies that you believe in, I suggest you find a dentist who believes in your philosophies. A biologic dentist, a holistic dentist, a natural dentist, a biomimetic dentist, a functional dentist. I mean, there is so many names for the same thing these days. You just need to find the one that works for you. And you can interview dentists. You absolutely can. You can just go in the office, say, I'd like to meet the dentist. Ask them a couple questions and see if this person is somebody who would work well for your philosophies. That's where you should start. Don't just go to your insurance plan and things like that. That's completely backwards. Meet the person. All right, on we go. One day ago, Miss Lady Light 3209. I had a root canal on tooth number 19, lower left first molar, decades ago, but the tooth got infected. And because I didn't get a cap on it, it had to be extracted. Yes, root canal teeth become brittle. And when they become brittle, they crack, often in half. And so this is why a root canal tooth often needs a cap right away. On she goes. I later got a bridge to replace that tooth, right? Two caps on either side with a fake tooth in the middle. Now, years later, tooth number 18, the one behind it, is infected and needed a root canal. My question would be, of course, why is it infected? Probably a bite issue. Maybe it's decay underneath the bridge. We need to find the root cause of why it happened. Seems like this is the second time. We should figure this out soon. And needed a root canal. I decided not to get it, right? So now a year later, I had bridge sectioned and got tooth removed yesterday. So she had the tooth removed, left the front part of the bridge, and now she's missing two teeth. I have back and neck pain, not only from arthritis, but aggravated from an accident. Wondering if I will find relief and more increased range of motion. Thanks for video. Next up is trying to figure out how I'd like to replace missing teeth 18 and 19. So that was a very well stated question. Good. So we followed the same trends. You had a bridge, the back abutment, the tooth behind it failed. We need to figure out why that is. Otherwise, you're going to be doing this again on the other teeth, right? And you save the tooth at front, which is fine. We do this a lot. We section the bridge. And you now want to know if this is going to make you feel better. And, I can't say for sure. I've seen it happen over and over and over, but mostly if the tooth was removed biologically, right? If we don't remove it using ozone, PRF, PRP from your own blood, then we risk the 80 something plus percent of getting a cavitation from an extraction or a bone infection. Not like you would feel it, it's inside the bone and it causes problems as well. So, biologic extraction or making sure the extraction worked well would be key. That would be done with a 3D scan, CBCT, and we would do that after healing, 3 to 4 months. So, we won't know anything until then. How would you replace those two missing teeth? Well, that's what I do every single day. I replace teeth with ceramic or zirconia implants. They work fantastically well. I don't do titanium anymore. I haven't done titanium in over 10 years, I think, maybe something like that. And that's because better options came up and I researched them. I became a speaker for them as I started to place them because they are a way better option. So, zirconia implants, SDS, Swiss Biohealth Institute in Switzerland, makes the best, in my opinion, for many reasons. So, I would consider that. I would wait, that the tooth is already gone, I would wait for healing. You could have done it immediately, probably, but I would wait for healing, 3 to 4 months, 3D scan, and then plan on placing the implant. Thank you for your question. On we go. I do not know why people post, timelines of the video. So if somebody can tell me why we are posting timelines in the video, that would be great. Maybe I'm totally missing something, but I have absolutely no idea why people are placing timelines in the videos. Okay. Next one is, let's see if this makes sense. Tony Weber said, I've had several root canal treatments done in multiple teeth over the years, and every single one has failed. Some within a few months, and one lasted 5 years. After switching to a different dentist, he advised me that my teeth are now too far gone to save and recommended implant supported dentures. I really appreciated his honesty and wanted to waste my and not want waste my money and time. Even though I'm not happy to be getting dentures in my mid 30s. I agree. I'm looking forward to feeling better though, and being healthy, and most importantly, no more infections. And from the info in your video, hopefully, no more lower back pain either. All right, Tony. Yes, sometimes um, there is a reason for all these root canals, and it's not weak teeth is not what the answer is. So I don't know where you're at in your journey, but if it is that bad, and it could be many reasons, and you are at the point where you can only remove the teeth, then implant supported dentures do work really well. Now, in the United States, we don't do those yet with zirconia implants. There's some FDA challenges, and we know the FDA is just so wonderful and trustworthy, but some FDA challenges to get them approved for that. So you will be using titanium implants. Now, titanium implants, you've seen my videos on those, are not my first choice. They do work, they've worked for a long time, but you have to understand the limitations and you have to make sure you maintain those implants so they don't become an irritant. The surface of the titanium implant, which is going to hold your denture, is ceramic. Literally, it's a coating of ceramic. And that's why it works. If you scratch that surface and damage it, you're now into the titanium TiO2 particles. Those are not biocompatible, and those will cause that chronic inflammation you see with titanium implants. Around the tissue, it's called peri or round implant mucositis. So, infection or inflammation of the tissue around the implants. Very, very, very common. More than 50% of them get this. Why? Because scratching, acids like fluoride and things like that will etch the implant and destroy that coating. Hygienists cleaning the teeth wrong, and so forth. Bacteria releasing acid. So you need to maintain that surface very, very carefully. Secondly, if the implant starts to fail because of the TiO2 particles, now you have peri-implantitis, infection around the implant, and then the implant will be lost. So they work great. I have family members with titanium implants. We didn't have ceramic back then. So, yes, definitely maintain them well and figure out if it was diet that caused these teeth to fail. The teeth are the Trojan horse, and the rest of the body has been infiltrated by whatever is going on. So, manage the bacteria and manage the body's chronic inflammation from them. So, you do want to change and find the root cause. That's very, very important. All right, on we go. See if we have another question. All right, I've had done. All right, Rudel Hertz said, I had this done and was fine. However, and I think she's talking about a root canal, if I had to guess. However, I got pregnant short after and suffered a terrible miscarriage 3 months later. Sorry to hear that. That's awful. The baby's heartbeat suddenly disappeared. It had been perfectly healthy according to the pathology tests. Now, I was told it could be a side effect of a root canal treatment. I am shocked. So, if I tell you that it was the root canal, then the endodontist would be very excited because then they could jump on me and try to take my license. I could still do this, but I couldn't help you with removing root canal treated teeth. So, can we say it was related to the root canal? We can't. But bacterial infections around teeth, including root canals, have been known to have an effect on babies in your tummy. Around the placenta is affected. It crosses the placental barrier and it affects the fetus. So, is there a relationship between bacteria in your mouth, around your teeth, and around implants, which tend to have a lot of infection? Yes, 100%. So, just like if you needed surgery or some kind of hip replacement or whatever, go see a dentist. Make sure there isn't any infections, which would include root canals, and then treat that first before trying to get pregnant again so you have a successful pregnancy. That would be my recommendation to you. Now let's go on. I got one more, and then I'm going to have to go fix this car. Hopefully. Mm-hmm. So there was somebody who posted, thank you for the video. I'm looking forward to your video on options after extraction. Could you also talk about risks of zirconia implants? We did that once already too. So, yep, the options of the extractions. There is a video that tells you what I would do. And I chose zirconia implants, and that, of course, is very well known in this channel. Good. I think that's all I really honestly have time for today. Let's go back here. So there you go. Q&A on mostly root canals again. Seems that's what you guys are mostly interested in. Let me know if there's anything else you want to learn about. And as a reference point, I'm 52, almost 53 years old, and really have no health ailments. I don't regular exercise more than walking, and sometimes I should be going to the gym, but I'm as healthy as a horse, as you would like to say. Plenty of energy, not really ever tired. So what's working for me at my age is that I'm focusing on diet, I'm focusing on biome, focusing on mental attitude, optimism, and things like that. So I try to create a way for people to stay healthy and get healthy if they aren't, without having to go through 1,000 hoops. simplifying optimal health. If that's something you're interested in, let me know in this video so I can make some videos on some tips and tricks for health span, not lifespan, right? How can you age well? How can you get better? Unlimit your biology, as I like to say. And how can you harness the power of your biome, which is what's keeping you alive in the first place? I hope you guys enjoyed this. I'm Dr. Chris, the Detox Dentist, and I will see you next week.